All right, we are here to talk to our CCOs in the Tri-County region. So we're here to talk to Trillium and to HealthShare, and they are going to speak to us today about a topic that we chose last time we met, and it's about care coordination. So right now, what I'd like to do is I'd like to introduce our CCOs, and for each of our CCO panelists, you can please share your name and your pronoun, who you work with and what you do briefly, and just for fun, if you have a superpower or you would want a superpower, let us know what it is. So I'm going to move to our introduction slide here. Today's topic is the care coordination role, what to expect, and how community partners can help. So we're going to start this time with HealthShare, if that's okay. And so we'll start with HealthShare introductions, then we'll do Trillium introductions, and then HealthShare can start their short presentation. Trillium will do their short presentation, and then we'll have open Q&A. And the total will be approximately half an hour. All right, so HealthShare, I'll let you start off.
Perfect. Hi, everyone. I'm Stacy DeLeon Davis, she, her, Aya. I'm the Community Engagement Program Manager with HealthShare. I have been with HealthShare since I believe I started in April. I can't really remember. So fairly new. And if I had a superpower, I think I would want to fly. I would want to fly wherever I needed to go just for efficiency's sake. I don't like to waste time. And then I have always have my folks with me. So Nancy and Allie, whoever wants to go first, go ahead.
Hi, my name's Nancy Thompson, and I'm also with HealthShare. I am the member navigator. I work with Pat and Stacy and Haley. So we're here to help you in any way we can. For superpower, well, I'd like to be able to transfer myself. So probably, I don't know if I would fly, but I want to give us credit for it.
Nancy, I'm going to have to interrupt you. I think that your audio is very pixelated, for lack of a better word. Are other people hearing that as well?
Yeah.
So if you can please hang up and call back in, that would be great.
It might be kind of a weird echo thing too.
All right, bye.
I'll introduce myself in the meantime. Is my audio okay?
It's great.
Awesome. My name is Allie. I work with HealthShare of Oregon. My pronouns are she, her, hers. I am the other member navigator. I work very closely with Nancy. And if I had a superpower, I'm gonna have to be very boring and say teleportation. Same line of train of thought as flight. I'd like to travel all over.
Mm-hmm. My son is going to develop teleportation, so just stay in touch.
Okay, yeah, definitely let me know when he gets that going.
Will do. All right, and should we move over to David? Oh, you're on mute.
Once again, thank you for the reminder. Sorry, I have sun streaming in here. I apologize on the camera. So David Hidalgo, pronouns he, him, his. In terms of work, I work with our Trillium colleagues here on the phone today. And as I mentioned, I work more in our provider network areas. So work with contracting, specifically for behavioral health and integrated strategy partners in the community. And I also have a shared role with our population health team to support behavioral health case management and our behavioral health ICC staff. So that is anything around contracts and also making sure that members get what they need from a case management standpoint on the BH side. My superpower, I would love to be a super healer, ensure everyone has access to healthcare. And with this COVID thing, and you know what? Great to be with y'all. Thanks.
Thank you, David. Do you want to pass it on to somebody else from Trillium?
Oh yeah, let's pass it on to Christina, please.
Thanks, David. That's a great superpower. I was thinking the same thing, but my name is Christina Rogers. I am also with Trillium. I am a community health worker. My title is Community Health Service Representative. And my pronouns are she, her, hers. If I had a superpower, Right now, during these times, would be to clone myself, so I could be at both my kids' activities, and just having two of me would be great sometimes. And I will pass it on. I am not sure if Rebecca's audio is working, but she's with Trillium also. Are you here, Rebecca?
I'm here. Can you hear me now?
We can.
Oh, perfect. Hi, I'm Becky Smith, and I'm the supervisor for the intensive care coordination team here at Trillium, and my pronouns are she, her. I'm going to have to go with the majority here and pick transporting as my superpower, because I feel like if I could spend my lunch hour on a beach, I would come back so much more refreshed for those afternoon meetings. So I'd probably pop myself in and out of some relaxing activities when I could. And I think that's all of us today from Trillium.
Well, thank you very much. All right, so we're going to have HealthShare go first. I couldn't remember who went first last time, but I just picked HealthShare. And so I'm going to pass it back to HealthShare to answer our question of tell us more about the care coordination role, what to expect, and how community partners can help, or whatever else you're going to talk about regarding care coordination. And as community partners, you can be listening and generating your questions. Feel free to type them into the chat box, or we can call on you afterward. So HealthShare, please.
Thank you, Deanna. Do you happen to have the slide deck?
Yes, thank you.
Presenter mode?
Absolutely.
That would be great. Yeah.
I'm working on it. It's really hard to move everything around on my computer. Here we go. All right, can everybody see this? Basic health plan navigation.
Right now, I just see the same. Oh, now, okay, now it's up. Yes, you got it.
Great. Excellent.
All right. We're always bringing it back to the basics, right? So this is not going to be any surprise today when we talk about care coordination and really talking about our structure around having our partners, our plan partners, OHSU, Legacy, Kaiser, and Providence, and also Care Oregon, who all have their own care coordination teams. Right. So if we go into the next slide and we talk a little bit about what is care coordination. And I'm sure most of you are very familiar with the care coordination process. But basically the care coordination is a service that can help you understand your Medicaid and OHP benefits and also help you navigate those crazy internal systems inside the health plans to understand and get you what you need and what you're asking for. All members have access to care coordination services. And since we are unique at HealthShare, you'll have to call, the members will have to call their care coordination team through their provider. And then we also have our behavioral health care coordination, which is available through Care Oregon. So Care Oregon manages our behavioral health. So if we go into, and this is going to be super, super high level and just basic again, but then we'll have a conversation a little bit about how we can help with the care coordination side of things. So here's an example of Care Oregon's care coordination. Their care coordination team consists of various roles and disciplines, such as a triage coordinator, a telephonic RN, a healthcare coordinator, a pharmacist, oral health support, a behavioral health specialist, utilization management and benefit review nurse, and so on. So that's how, when you think of the care coordination team, you have to think about it from a holistic approach. So not just one thing. They aren't just going to tell you what your benefits cover. They're also going to, point you in the right direction to get to the pharmacy and make sure that you have the medication that you need. They're going to hopefully get you that wheelchair, right, that you've been asking for. And then also get you that culturally specific behavioral health treatment that you need as well. So we talk a lot about calling the number on the back of your card. So on the next slide, that's what we're going to dive into, is call your health plan. Again, we are very unique in our setup in that HealthShare doesn't have a care coordination team. We have our health navigators, but we do not have a care coordination team. It is really up to the member to contact their provider and to contact their care coordination team on the back of their card for their provider. Next slide, Deanna. I think it's the thank you slide. Oh, so
It is. Is that where you want me to be?
You can go back to the to this slide. That's fine. The care coordination. Yeah.
Okay.
Yeah. So I guess my question to you is to the group here, do any of the community partners here have any challenges? Well, I'm sure you have challenges, but this is also holding us accountable, right? And I may not have all the answers, and I'm here to listen, and I'm here to take notes on how we can do better. So, what are some of the challenges you do have, or that, you're seeing on behalf of our members when you are calling those care coordination teams? What does it look like? What does it sound like? Are there any, challenges, but also are there any successes? And what does that look like as well? Can the setup be a little bit more efficient? And then also, if you have a story you'd like to share, that would be great too. So really, this is just an open discussion on what's working, what isn't, and what can HealthShare do, and how can we hold our plan partners accountable for their care coordination team. And then also just being mindful of, we can only control so much. So what can we control? What I can control here today is collecting all of your information and feedback and taking it back to our plan partners, care coordination teams, and saying, how can we fix this? So it's not going to be an automatic, immediate, fix, but I just want you all to be mindful of what can we control. So with that in mind, let's have an open discussion about what you're seeing, what are some challenges, and how we can take that back and figure out a plan.
Thank you, Stacy. Let's see. I would love to take a couple questions. I think HealthShare and Trillium are different enough that I'd love to take a couple questions about HealthShare, and then we can move on to Trillium, and then we can have an open discussion. And Stacy, I appreciate you asking about challenges, because last time what we really heard was, there's something that's supposed to happen here with care coordination, and then there's the reality for some of the cases. And so I really appreciate you being willing to dive into that and be asking about that. That really says something. We do have a question in the questions box here. So the question is, I think one thing that can be tricky with HealthShare is for patients and providers to figure out the division between a behavioral health need and a medical need, because they often overlap, of course. So can you speak about, depending on what the need is, do they access things differently, and how do they figure that out and navigate it?
I'm actually going to look to Allie to help me answer that question.
Can you hear me at this point, Ms. Nancy?
Yes.
I
can hear you, Nancy. You have my name, but we can hear you.
Oh, hello. You have my name again. There's something wrong with my computer. Anyway, hi, Maria. This is Nancy. Actually, there are two divisions. And what happens if you are in a Care Oregon plan, obviously you're going to have your care coordination for medical with Care Oregon and your behavioral health with Care Oregon. It is hard to determine, if it's something that is a behavioral health need or if it's a medical need. So on our end with HealthShare, especially Allie and I, will work with the member or work with the triage team or work with the state and get as much information as possible on that member, so we can make sure that the member and the plan are being hooked up together in the correct mode. Sometimes, actually, if you really think about it, most of the time, you're going to have a mental health need and a medical need. And so the plans will overlap and work with each other. So Care Oregon would be working with Providence or Kaiser. So that is the majority of the care coordination that we work with. They do overlap together. And for us at HealthShare, we try to put them together to make it work. I don't know if that makes sense.
Is that sort of the no wrong door approach where you
That
take what's presenting right now, you call and they loop in the other ones?
There is no wrong door. And that would have probably been the end of my speech, yes. I know I work with Maria a lot, and there are some challenges. So yes, and of course you can call me. You can call me anytime. Or Allie or Stacy or Todd, any of us would be happy to help you, but I know we've been in touch with each other multiple times. But there is no wrong door. You are right. But within HealthShare, we will work with a member, plan, the state, whoever needs this, to make sure that that member is being treated for both mental health, behavioral health, or medical. But a lot of times they will overlap. In fact, 80% of the time, don't you think, Allie, that they will overlap each other?
Thank you. That was helpful. All right, so I don't see any more questions at the moment. So what I think we should do is move on to Trillium, and then we can open it up for a wider discussion. Does that sound good to everybody?
Sounds good. Thanks, everyone.
All right, then I will hand it over to Christina and team.
Hey, Deanna. Did you receive my slides, or do you?
No, I did not, in fact, but I can I can give you a presenter view. How about that? Or presenter abilities. Is that okay?
Perfect.
Okay, let me find you in here. This will take me a moment and I apologize. There you, Christina, is your video on?
Yeah, do I need to shut my video off?
No, I'm trying to find you, but it's that your video isn't showing. Oh, wait a minute, on my computer. Hold on. I'm sorry, you guys. Why is this so clunky? I really apologize. It's because my screen is not big enough for everything that I'm trying to do. So just bear with me for a minute.
I just emailed you the slides if that's easier.
Well, I'd shut down my email just for security purposes. So
Oh, gotcha.
there you are. Okay. Wow, what was that? That was challenging. All right, I'm going to make you a co-host, and that should allow you to be able to share your screen. And so I'm going to stop my share.
Okay.
And you should be able to share yours. We can see something. What can we see here?
Let me see here.
We see a lot of files on your desktop.
Oh.
And a PowerPoint way off in the corner.
Okay.
There we go. All right, you are in action.
Oh, did that mess it up?
You can click your, it did set up, but we could also see your preview, which is okay. We can see the next slide. It's like a teaser.
Okay, I'll try it this way. How's that?
That's fine.
Okay.
I think that works.
So I will be presenting on our care coordination also. So how can we help? We have several ways to connect with our members for the purpose of assisting them in navigating the complexities of healthcare in partnership with their PCPs, behavioral health, and oral health teams. So all our members have access to our staff to help navigate the healthcare system, to reduce barriers to care and facilitate timely access to services. So similar to HealthShare is, one of the ways that members could get connected with our care teams, our care coordinators, our case managers, is calling member services, if they have questions about their benefits. And or if they just need help with care coordination, connecting to scheduling appointments or addressing their needs, whether it be, you know, questions about transportation. We have several care coordinators in each department, which is in our clinic. We have our clinical staff, which is our RN case managers, our behavioral health, and our disease management programs. We also have our Start Smart for Babies, who have care coordinators and RN nurses, case managers that help with that. We have our intensive care coordination team also, for those who need it. And how do members find out which, what their needs are? Because I'm sure as a member, they don't call saying, I need, intensive care coordination, or, I need help with my disease management, and et cetera. So with our Trillium care coordinators in case management, when a member calls and just needing that additional support, our care coordinators or our case management will do what we call as a health risk assessment. And this helps us identify what the member's needs are. And that's when our team can, put in a referral, whether it be for behavioral health, for the intensive care coordination, for Start Smart for Babies. All our teams work in collaboration. So if a member has a medical need or disease management, but also has some behavioral health needs, our team will put in a referral for behavioral health care coordination, and also for our case manager nurses, our care coordinators under our case management team. And they could have both help from our behavioral health and our case management. Our teams work closely together so that when a member has contacted or had their scheduled routine call with one of our care coordinators, the behavioral health care manager will also know the member's concerns or needs also. So they work in great collaboration together. And this is just a little bit about the intensive care coordination. So those who fall into the intensive care coordination are members of priority populations, members who experience retriggering events, and also our teams, on all our teams with care coordination, they also work with connecting members to resources, whether if a member needs additional resources or additional support, we also connect them with our community health workers, which is the team that I am on. So we work closely with our case management and care coordinators to also, we all just kind of work in collaboration to address all the members' needs and treat them as a whole. So referrals to case care coordination or case management, the member, our providers, our member representatives to contact our member services, which is also located on the back of the member's ID card, or they can email our Trillium case management, or you could fax. So again, there is no wrong door either on how we receive referrals or how to connect our members to care coordination and case management. And that is it. Thank you. I'll stop sharing my screen. Let's see.
Thank you. I'm actually a little bit curious. Let's see if we have any questions before I ask mine. Oops, there's still people in the waiting room. Shoot. Can a provider request intensive care coordination if a member consents, of course? And do the intensive care coordinators or others ever work with people in person in the community?
So I will let Rebecca answer that question because that is her team. Are you?
Hey, can everyone hear me?
Yes.
Yes.
Okay. So anyone can request intensive care coordination. We oftentimes do get providers who send us over referrals. and sometimes the members have talked to the provider and agree ahead of time, but sometimes providers have concerns, and we'll also talk to members and really let them know about intensive care coordination and what the member really drives the care, whether they want that level of care coordination or not. Yes, we love being in the community with our members. We go to their homes. We will meet them at a park, at a coffee shop. Like, we will meet members wherever they want to meet us. Unfortunately, like everything else in the COVID world, face-to-face meetings are done really on a case-by-case or some sort of extenuating circumstances. We're all obviously working from home still here at Trillium, and are not regularly doing in-community meetings. But yes, our program is very much boots on the ground driven. We really want to be wherever the members are, and what's most comfortable for members. We will bring them in the office and book a conference room if they're more comfortable coming to us, or we will go sit in their living room and talk with them if they're more comfortable, or if that's better for accessibility for members. On the intensive care coordination, if people aren't aware, it's a much higher level of care coordination. We do weekly phone calls, check-ins with members, monthly care team meetings with members, providers, THWs, behavioral health, whoever's involved in their team. We come together on a monthly basis. They do have care plans. We work with providers on their care plans and coordinating care amongst all of us. So it's a higher level sometimes than members want, but for members who do want or need that level of care, we're prepared to offer that higher intensity, more frequent contact care for members.
And my question is really a follow-up from that to some degree, is when somebody calls, how do you determine if that member needs intensive care coordination, and approximately how many members, and like, what is there a percentage, or is it just that you can estimate of people who are receiving that level of service? I'm curious how common it is.
I can't give you any numbers off the top of my head, Deanna, but we actually let the members determine. I mean, we get referrals for members, and when we talk to them about the variety of services we provide, sometimes they choose this level, sometimes they don't. It can probably feel maybe too intense for some members. But some members also like having the frequency of contact. We give them, our direct cell phone numbers, so they won't have to go through a call center switchboard. We can communicate through secure email if they prefer. So we really kind of let the members drive. If they want something, if they have like a one and done kind of need, like maybe they're having trouble getting one specific thing, or having access to appointment with one specific provider, we probably care coordination through case management will help them. But if they're having ongoing issues, maybe they want to keep a provider, but they don't feel like their needs are getting met, we'll, work with that. Or if they have multiple DME needs, or different therapy needs, or we're trying to coordinate multiple things and they really need that intensive level, we really kind of let the member decide how much they want us in their lives and how much they want to, have contact with us. Some people would rather be monthly or quarterly, then they wouldn't necessarily qualify.
Gotcha. And I think part of the question that I heard last time and part of the follow-up was, how can community partners be involved? So maybe can you speak to how a community partner might help get a member set up with intensive care coordination or any other care coordination?
Yeah, a community member could certainly make a referral, or maybe sit with a member to call in, depending on what their role is with that member. Maybe sit with them to call in, and we can all work together. That helps with getting ROIs and different things going if we need that, depending on what their involvement is with the member. But certainly when they're doing intensive care coordination, if a member is saying, you know, I want this community partner to advocate for me, or I want them to be on board with my care, you know, we will work with them in those monthly care team meetings and make sure that whoever the member is wanting to be on their care team or to work with them in an advocacy kind of role, that we're bringing them to the table. Like, we want as many people involved in those meetings as we can to assure that members' needs are being met from every angle, that we're looking at not only their physical health needs or behavioral health needs, emotional support. Maybe they just want the person who gives them rides to be involved, to know more about protocols or something. Whatever agency or support system the member has, we in intensive care coordination, we want to bring them to the table as well.
And you said something about referrals. Were you suggesting that a community partner could call the CCO and say, hey, there's this person who we think could really maybe benefit from either care coordination or intensive care coordination? Can you have them on your radar? Is that something, is that a role, or is that not how it happens?
I think that that's how it could happen. We have had mostly providers' offices, not necessarily community partners, call in and say that. Sometimes they go through the CHWs. Now, right now during COVID, they're not doing as many facility visits, but Christina can share more. Our CHWs were going out to different facilities and going out to different community partner offices and meeting members there, talking to members about our services, you know, and doing that as sort of a referral. So if a community partner were to have somebody who would think they could benefit from what we do, that we get referrals that way as well.
Great. I'd like to take a few questions from community partners and maybe have HealthShare and Trillium answer them. So does anybody have questions that you'd like to pose for responses? Right. Can an intensive care coordinator facilitate access to flex funds for a Trillium member? Christina?
Christina, I wasn't sure if you were going to talk about that. Christina's team actually does the flex funds, but we very much work together because oftentimes we'll be on the phone with them and discover that, you know, they're about to be discharged from the hospital with no place to go, or they need some motel funds, or you know, they need something, air conditioners or something that's not covered. And so our team works very closely with the community health workers who do the flex funds.
Thank you.
That is correct. So often any of our care coordinators, because flex funds can be requested by providers. We've received some from community-based organizations. Of course, you know, there's additional paperwork and everything, but we do our best to coordinate to help them get those needs met and get the correct documentation if needed, or get them to a provider to get the documentation so that we can help the member meet their needs. But we often do receive internal flex funds coming from our care coordinators, intensive care coordination, and our case management team and our behavioral health team.
Thank you. Can HealthShare address that question as well? Stacy, maybe, or one of your team?
I'm going to point to Allie on the flex funds conversation.
So the question is, can care coordinators be the ones to connect a member to flex funds and request the flex funds for that member?
I do believe that it is maybe a little bit dependent on the flex funds request, but I'm fairly certain that it needs to go through some kind of primary care or some kind of provider that they're receiving access and receiving services through.
Thank you. All right, the next question. If we were to submit a referral for a CCO, I think meaning to connect to a care coordinator or an intensive care coordinator, is there a form, or do we just call the regular Trillium or the HealthShare line and say that there is a member that might benefit from some care coordination or intensive care coordination? Can you speak a little more specifically to how that might work as a referral from a community partner?
Yeah, so from a community partner, it would be by phone or email to our case management, as you know, as long as they're able to send it securely. Otherwise, we would, ask that they call member services and state that they have a referral, and they'll transfer them to the case management care coordination team. If it is a provider, I believe on the provider site, and maybe I'm not too familiar with the provider site, but from my recollection is that they can send in referrals through the provider site. But I could check on that. As far as for community health work, oh, sorry, I was answering the email, but yeah, or they could call from a community-based organization, and then or they could send a secure email.
And I saw that you put the phone number and the email there, as long as they're sending that email securely. Was that caveat? Can they request a secure email envelope from you if they don't have the ability to generate secure email? Do you have ability to send an email and have them reply securely?
So I don't want to say yes, but I believe I believe when we send a secure email, it does come back, but I do not want to.
I can imagine it would. That makes sense.
Yeah.
All right, maybe Stacy or somebody from HealthShare, can you speak to that referral process?
Yeah, so anytime a community partner wants to send in a referral, they can send it in by email or phone to the health plan, directly to the health plan, so that it wouldn't come to HealthShare. Is that correct, Nancy?
Well, okay. There's a couple ways this can happen. We work with a lot of the CBOs, and if we can receive them also from a CBO requesting the information or the referral, and we can actually send it over to our plan partners. And yes, for secure email, if the CBOs are sending us an email, we ask them to resend it as a secure, and we will send them the link to send, so they can send it to us secure, so we can send it on to the plan partners.
Thank you. Nancy, can you take a moment after, when we're talking about something else, maybe to type into the chat box for the main HealthShare, kind of who they would contact, the phone number and the email for requesting a referral?
Sure.
Thank you. Okay. And let's see, what else do we have here? Can a CHW or a behavioral health professional write, I'm assuming that's what BH is, write the charge note for the Flex Fund services and have the PCP sign off on it in order to be requesting Flex Funds? So Trillium first and then HealthShare, please.
So we have received Flex Funds from community health workers or behavioral health that have chart notes, and yes, with the PCP signing off on it, as much documentation as possible. Our community health workers send it off to the committee at Trillium. So the final decision is made by them, and if additional paperwork is needed, then we get back with the requester.
Okay. HealthShare.
Allie, are you able to answer this question? Or Nancy? Sorry.
Yeah. So can CHW or behavioral health write in the chart note and the PCP sign off on it? I believe as far as Flex Funds are concerned, it's anybody that is providing health services that can submit a Flex Funds request. Is that correct, Nancy?
Yes. Is that the question though, Deanna?
I really think it is. It's, maybe it's not specific to a CHW or behavioral health provider, but it's really who can request Flex Funds, and can it be somebody else besides the PCP and just have the PCP sign off on it?
Yes.
I think that's where the question is coming from. That was my interpretation. All right.
Anyone can complete the HRS form.
Okay. I'm going to table this question about services for homeless individuals with severe persistent mental illness. For a moment, that feels like a big topic. That could maybe be our next topic next time, is how you handle health services and supports for maybe that specific population. But it feels like potentially a big bucket of discussion. So I'm tempted to move on to the other questions right now. Do you need an ICD-10 diagnosis on the Flex Fund request in order for it to be considered or honored? Oh,
This
you
is
do
Nancy.
need, it's a statement. Thank you.
Okay.
I think it's the clarification. So somebody can put on that request for flex funds, but it does need an ICD-10 diagnosis. And I don't know what that means, but I'll assume that many of you do. It needs some sort of code on it, I'm guessing. Can somebody speak to that to clarify?
This is Nancy. We're actually we're working on that question actually, because if a CBO is requesting any type of HRS, they're not doctors. They can't, they aren't able to put an ICD code on there because they wouldn't actually know. So there is a huge conversation going on this right now in our meetings. So yes, but it can't come from the CBOs because they aren't able to give us an ICD. So that is a question.
Thank you. Did anybody else want to comment on that from our CCOs?
Nancy is correct. We're kind of there also with the diagnosis.
Okay. All right, and I'm going to take this as the last question right here, just in the interest of time. If the community-based organization is a primary care provider, oh, that's another statement, sorry. The provider could give the code. So yeah, so you can work together with that primary care provider. So somebody can request it in general, and the primary care provider can put that provider level code on it that is needed in order for it to be considered. That's what I am reading into that. Okay. All right. The next thing I want to ask everybody, and I will go back to sharing my screen because it's really the next slide, and it's pretty basic. The next slide basically says, oh, right. It tells you where you can find the CCO materials. So we do have a place in group site where we post all of the PowerPoints and stuff that the CCOs give us. And so you can always find this in group site. And what we like to do is take a moment during this meeting to say, based on what we've discussed today, or based on what your other needs are, what topic would you love to see the CCOs bring to you next? And I heard a question in the chat box that might spur some interest. It's really the question of individuals who are homeless, especially those with persistent mental health disorders, there are some extra challenges there. And what tools or programs do our CCOs have to help that population? So that's one possibility. If you're interested in that, you can write it into the chat box, but please give us other ideas as well. And we will take them into consideration and bring something else to you next month so you can learn about our CCOs a little bit more. Let me look up, whoops. All right, so I'm gonna go back to our chat box and see if we have anything coming in for ideas. Actually having a hard time seeing it. Preparation for 988 line collaboration with CCOs. Interest in the homeless topic. Okay. I will let folks continue to write in there for the next few minutes. And what I will say right now, before I stop this recording, is thank you very much to our CCOs for Trillium and HealthShare being here and bringing your teams to bring topics and to answer questions so that our community partners can get to know you better. So big thanks to you, big silent round of applause, and until next time.